I hope everyone came. Still, we have to wait for 1 minute. Let's see if one comes. Still, people are coming. Just we have to wait 1 2 minutes. Hi everyone. This is Dr. Adnan Sheikh, CEO and founder of Physiological Healthcare. Let's welcome our resource person, Dr. Shiba Kausar. She will be taking your class today. Thank you. हेलो मैडम. हाँ, आप अनम्यूट कर लीजिए अपने आप को.
हाँ, आवाज सुनाई दे रही ना?
I hope English language will be better.
हाँ, आवाज आ रही है ना मेरी?
हाँ, yes.
Yeah.
Okay.
Yes, madam.
So let's get started. So myself, Dr. Shiba Kausar. I'm working as an assistant professor in Manjunatha College of Physiotherapy. So today I'm here to talk about the importance of cupping therapy and how do we use in the physiotherapy field. So before we get into it, let me have a short information like what is cupping, from where it has come, from where it has originated, and how we can use in our physiotherapy field. So, what are the techniques we can use and how we can deal with the patients, and what sort of conditions and what sort of methods we can use in cupping therapy in treating the physiotherapy conditions. So, I would assure that by the end of this session, you would be knowing it in what conditions, what type of technique can be used. So, let's get started. So, before entering into the cupping, so let's just know the history from where it has come. So definitely cupping was being used from a very long time. That too I could say 1500 BCs. In that time, from that time cupping is being used. Imagining all sort of countries like Egyptians, then Irani, Europeans, everybody were using the cupping therapy but into their own method. So the concept behind using of cupping therapy was started from 1500 BC. The two concept which they used to follow was the first one, starve the source of the sickness of the body, and second one, bleed to drain it away. So here, in previous days, so antibiotics were not there, right? So what it used to happen, so definitely people used to take lot of rest and they used to eat healthy things in the same way. But now, as per the 21st century, but we are into the antibiotics. But that time there were no antibiotics, no medicines, nothing. The only precaution they used to take was healthy food and have a good rest and have a good sleep. So that's what the first point. And the second point is bleed to drain it away. That means that they are going to remove the toxins from the body, and whichever condition it is, any conditions, fever, or they could say joint pains, osteoarthritis, rheumatoid arthritis, any condition, they used to think that the foreign toxins is supposed to remove out. So these were the two methods in the history, ancient time they used to follow to treat the condition. So later on, this was used in the Middle East that it came to the Muslim world that is known as hijama. So they started practicing because of their prophet, the last prophet, peace and blessing be upon him. He said that cupping is the therapy where you can puncture and treat any sort of conditions. So it is been said in all the holy books that how cupping can give you the results. Then in the late 1800 BCs, later on, when the antibiotics and the allopathies came into a play, cupping went down. So cupping was sharply criticized by medical fraternity and had fallen away as a popular method. There were few speculation as to why this had happened, but we would say that because of the enter of the antibiotics and because of the enter of the allopathy medicine, there was a decline of cupping therapy for a while. But now again, cupping therapy is in trend. So now again cupping therapy is back into a more advanced way, into a more pro version where we are treating the condition. So now let us know what is cupping. So everybody must have been seen in the look at this how the early cupping instruments which we use, the which one which is written ancient cupping tools. Here can you see this horn? So still this is being followed in the European where you can see on the footpath still people do this type of sucking. So on the top of the thing you will have a hole, and here with the help of the
Excuse me,
mouth
ma'am.
they used to
Sorry for the
suck.
disturbance.
Yes.
It's not visible, ma'am. WhatsApp screen is visible.
Oh, only WhatsApp screen is visible. The
Yes.
presentation is not visible.
No, no, ma'am. It's not visible.
Now.
Yes, ma'am.
Yeah,
It's
go ahead
visible
now.
now.
Yes,
Oh,
it's visible now.
okay, please let me know in the center, okay, if anything my voice is not audible or the PPT is not been visible. Thank you so much. Okay, let's moving on to the early cupping instruments. Here, can you see the arrow mark which I'm moving?
Yes, ma'am.
Okay, so these ancient cupping tools, which was used in those eras, still it is being followed as a very cheapest form of cupping therapy, where with the help of these horns can be taken from the buffaloes. So there on the top, they used to make small hole through which the suction can be created through the mouth. So later on, it was shifted to like in Afghanistan, they were using this type of cups where from here they would suck. And then in the European cupping lab, a little bit pro version in 18th century, they started following this. Then look at this. Then later on, we have started using this type of cups, where with the help of this pistol gun we are going to do. So as everybody know, this is the place where we are going to release the air, and on top of that we are going to place it and then create suction with the help of the gun. So now these were the older versions which everybody used to follow. So now exactly in the current scenario, what are the things which are using and what cupping can help? So what is cupping therapy? Here, can you see the skin upliftment? If you can you see the skin which has been uplifted? I have kept my hand ulta. So here what
Okay.
happens, so auto cupping means by placing the cup on the skin, you are going to create the suction where the skin is going to uplift it for few centimeters, which will inversely cause increase of blood flow to the area whichever place you have applied the cup. So I repeat, cupping is nothing but placing the cups on the skin which can create negative pressure inside the cup by with the help of the vacuum. So after that what happens, this particular area you are going to create the increase of blood supply to that particular area. So with the help of that, within few seconds, can you see some redness here? If possible you could see. So just with the help of few seconds, could you see that there is increase of blood circulation? Now, let me tell you what happens into the skin because of cupping, what happens in the joints, what happens in the muscles, what happens in the nervous system. As I told you, we can use in many conditions, but first and foremost is the cup where it is going to be placed, that is our skin. So skin is the largest organ which has more of blood supply, which is rich in sensation, which has more of nerve endings. So now any condition which has to be started from your skin, because we are placing the cup on the skin. So once we place the cup on the skin and we keep it for 5 to 10 minutes, you cannot go beyond 15 minutes. You have a approximity of within 50 minutes. That times what happens, you will increase the temperature and also the metabolism of the skin tissue increases. And most of the people have seen on the Instagram of somewhere that because of application of the cups, they must have got some blisters. And why that blister is getting, here you can see the next point, which accelerate the secretions of salt and sebaceous matter and excretion of water. So what happens when you are going to place more than 15 minutes, like 20, in some patients, if they are having more of like sweat glands, because here you are going to stimulate the sweat glands also. So once sweat glands is being excreted, definitely water vapors will come out. And once water vapors is coming out and you have kept this continuously for more than 15 to 20 minutes, definitely the blisters comes. And this where you get the newbies who are practicing cupping therapy, who don't have the exact knowledge for how many minutes you are going to keep. In those cases only you will see blister formation. So I repeat, when you're going to keep it, you are supposed to only keep for 5 to 10 minutes, or maximum you can go up to 15 minutes. But you have to keep on checking, the person should not get the blisters. So if the person is getting the blister, instead of reducing the pain, you're exaggerating the condition. And now many people, many students ask me, ma'am, why blisters? As I told you the reason here, it will stimulate the sweat glands that enhances for the excretion of the water vapors. Now these all are the things which are going to happen in the skin. So any conditions like psoriasis or any skin conditions you can take, but if the condition is active, do not touch it, because if it is active, very fast it will spread from one place to another place. So once the skin condition comes down, acting, that time you can help with the help of cupping to that area, and you can send more of blood supply to that area. So when you are sending more of blood supply, automatically you are sending more of nutrients to that area. So that particular area will get healed. And I will in further slides I will let you know what is the science behind cupping and how exactly the physiology happens inside the cupping, where you will see the results. So I would say each and every slide will be valuable for you. So this is the first where we will deal, that is your skin. Skin is the largest organ where you can see lot of changes in the skin. So now if I talk about muscles, so definitely we will see strains. Many patients comes from trapezitis or the quadriceps confusions, anything related to the muscle. So that time how cupping can help. Now there is something called lymphatic system in the body. So everybody would know, I guess all our practitioners here. So what does lymphatic system do in our body when a blood is taking out all the impurities and sending all the nutrients. This is the process blood is doing. But what limbs are doing? Limbs are going to collect excess of fluid or excess of wastage to one area and it will drop into the bloodstream. So that bloodstream will take the deoxygenated blood, or you can say wastage, and it will throw out. So lymphatic system is very important. Do you remember when we do massage also, we are going to take it from the distal area and drop in the lymph nodes. So wherever you have lymph nodes, now if I am talking about the back, so I am going to take from the pelvic area, the back side, sacrum part, from the down I am going to take and drop it in the axilla area. Why? Because I have more lymph nodes on that area. So why I am doing that? When I drop it in that sorry, lymph nodes, automatically the lymph nodes will drain the excess wastage and then it goes and drops into the blood. And once blood, the wastage is been dropped, it will collect and it will wash it out. And the new nutrients, the blood will circulate and pass it to that particular area. So this happens, the physiology happens in the muscles. Now let's talk about joints. So joints, the first point which I've written, increase blood flow to the joint. And second, increase the secretion of synovial fluid. So many osteoarthritis cases who are at the end going for TKR, I would say before that exercise is the one of the major reason where you can help the patient not to go for the TKR. Now you can ask me how. See, along with the cup, if you do dynamic exercises, usually exercise also will give you wonders of results, but imagine on that combination of the cupping if you're going to do, and when they are doing dynamic exercises with the help of the cupping, automatically they are going to produce the synovial fluid. And I am not talking about those patients who have completely no fluid and there is complete friction while they do extension, flexion, everything if they are going to do, which is very become very worse. There is no space in between. Osteophytes are there, completely degenerate, where they have to go for TKR, we cannot help for them. But people who are going to near to TKR, we can help them to preserve it. Now, for example, they are going to go for TKR for 10 years. What exercise can do and what cupping can do, we can make sure that they would not go to TKR for 10 more years. And how does it happen? It happens only with the help of the physical activity. That's what the agenda and that's what we promote as a physical therapist. So yes, in the joints with the help of the cupping. Now automatically you have created suction on the near the joint area. So blood flow is there, lymphatic system is working near the lymph area near the knee. That is working, circulation is very good. Then how come synovial fluid will not be produced? So that's where there are a lot of patients whom I have treated with dynamic cupping for knee, where they have started. Now, patients, I cannot do flexion. There are multiple patients who have got their flexion nearby to that the area. So definitely in joints also it gives you wonders of results. Now let's move on to the blood. Blood, as I explained you, with the help of lymphatic system. If lymphatic system is working very good, well enough combined, it is going to drain all the excess of wastage and the fluid, and it is going to move to the blood. And then blood carries all the wastage to one area and throw out, and that's wash out. Now when we are creating as I
One small
apply
doubt.
it became few reddish here. I don't know you would able to see or what here little bit changes in the skin. So only for few seconds
Ma'am,
I can
I have small doubt, ma'am.
yeah.
Ma'am, actually, just now you said no, ma'am.
You
Synovial
can ask
fluid.
at the end of meeting. Please don't disturb meeting in between. You can ask
Okay,
after meeting.
okay,
Once
okay,
madam will explain, you can add
okay,
at the end. Please don't
okay,
Note
sure.
disturb.
down the doubt what you had, okay? So you will not forget at the end of the session. You can ask the doubt. Okay. So let's move on. Now, as I am telling you, increase blood circulation, increase blood circulation. So definitely we require RBCs as well as WBCs in the body to heal. So here, if there is any abscess, I would say don't do cupping on that area, because abscess is formation of the pus inside. So when pus is there, the abscess is active. So there, avoid doing. So what people will do, oh, abscess is here, then you can do in the nearby area. No, don't do that, because the condition is active. You can aggravate the condition. But whichever area you want more blood circulation to reduce the spasticity, or to reduce the muscle tightness, or to increase the ROM, these places you want increase of ROM, to increase the blood circulation, you can use cupping. Then dynamic cupping will work much better. Now, if I talk about nervous systems, first and foremost, we are applying onto the skin. So people who have the sensory issues, where we in neuro we will learn, right, with the help of cotton keep stroking, then with the help of 1 point, 2 point, 3 point, keep doing that. Same like that, we have cupping methods, different methods, medium, weak, strong. I'll be telling you in the next session. So in that, now just remember, you can use weak cupping area to stimulate the sensory, superficial sensory, because here you have epidermis and down you have dermis. So I would say, with the help of the weak cupping, keep stroking on that area, so you can exaggerate or activate the epidermis layer, epidermis layer of nerve endings. So then automatically, once, like how in stroke and how in your other cases, we wait for the thing to automate, like how flaccidity stage will come. In flaccidity stage, what do we can do? Okay, I will not ask the questions, I will just tell. So yes, now when we have sciatica or any nerve related issue, along with the root of the pain, dermatomes and myotomes are very important into it. So along with the root of the pain, if you're going to place cupping on that area, and along with that particular L4, L5, then your S1, that route you can do, and you can make the patient do exercise, and then automatically the pain will come down with the help of your lymphatic system, your blood circulation. And in the muscles, what happens, as I told you, and still I will be telling you the physiology, what happens in the muscles. And now let's move on to the types of cupping. It is widely classified into two types, that is your dry cupping and wet cupping. So today I will be talking all about your dry cupping. So in dry cupping, we have, see, just now I told you about V cupping, right? So just look at this area. It is only one pull. What is the difference, I would say? So when I'm going to keep it on the skin, V cupping means I am going to put only one pull. That's it. Next, you will have medium cupping, where I'm going to do two pull. And I have strong pull. So that is the strong cupping, where I'm going to do three pull. This is enough. Don't keep on doing as much as you can. We only can do weak, medium, or strong. And I will tell you in which conditions you can do weak cupping, in which conditions medium, and in which conditions strong. So weak cupping usually we use to increase the superficial nerve endings, and also it can be used in the children who are below 7 years. So for those type of patients, we can use like CTEV cases. So if you can see on my Instagram page, I have used dynamic cupping to break down the contractures, and definitely I have got results. With the help of the cupping, I have break down the contractures of the knee, and within one session there is 10 to 15 degrees of increment. So the ROM changes drastically, and this you can see once you start using it. And next you have medium cupping. So medium cupping also can be used in adults or geriatrics who are above 60. And here, or if they have laxity of the muscles, then patients will not allow you to do cupping first of all. But yes, if they allow you to do with the medium cupping, it is not so irritable. But yes, as strong cupping, this will not give you the results. This is just for the comfort zone patients are using. It will increase the blood circulation. But when I talk about strong, this is the maximum you can do, and it will give you wonders of results. because when we have trigger points, so trigger points are not going to stay in the epidermis layer, it is going to stay in your dermis layer. And if you want, like if you want to take that out, you need strong cupping. And once you do strong cupping, then only you will see lot of changes and lot of results. And this can be done in any age group, but I would say not to be performed in the peds, not to be performed in the geriatrics. And here this can be used in all the adults, and if patients are feeling irritable, then don't use it. And we can medium cupping we can use as a moving or drainage cupping also. With the help of cup, you can release myofascial fascia, you can release with the help of that. Now next one you have moving cupping or drainage method. And why it is known as drainage method? Because it is going to help you in the lymphatic system. As I told you, what does lymphatic system done? It is going to collect the excess of the fluid from the body, and the wastage also collected, and it is going to drop. So as I told you, I'm going to start from the distal area and drop wherever the lymph nodes are there. So this cup, it is one of the method. It is a silicone cup. It is not like this cup. It is a silicone cup. Here, after application of the oil, with the help of this cup, you can just drain it. It will be a movable. It is not only done with the help of silicone, you can also do this with the help of this plastic cup. And when you can do that, when you are doing medium or weak, with that you can rotate and you can do the myofascial release and also release the trigger point if it is at the superficial layer. And next you have needle cupping. So here can you see the needle which is being placed? So I have placed the needle on the trigger point, and then I have done medium cupping here. It is not strong cupping. So here whichever area patient people who are following dry needling and all, so I would say okay, here first you stimulate how to perform it. Stimulate the trigger point. After that, place a cup. Use either weak or medium, but don't go with a stronger, it would be more irritating. So here you can release immediately the trigger points with the help of the needle. So imagine people go for dry needling with the help of needle you are doing. Here combination of cupping with needle. So immediately you're going to send the good cells to that area. So definitely when you're sending the good cell to that area, automatically the pain cells will wash away and the trigger point will release, and immediately patient will tell you the pain is reduced. And next very trending which has been going on is fire cupping, or else it is also known as flash cupping. So here you are going to reduce with the help of the fire. So what does fire do? Fire is going to create heat in the body, where you are going to create vasodilation, and with the help of vasodilation blood circulation is increasing, and once that increase, the pain particles will wash away. Like how we will study in hot water, fermentation should be done with the help of hot water by, same procedure is going to follow, but here practically we are using fire to create the suction, and you cannot do fire cupping in plastic cups. So there are some special cups, that is your glass cups. With the help of that, you there is a protocol how to handle that. Then with the help of that you can do fire cupping and place. But never try with the plastic cups or silicone cups. There's a special cups for the flash cupping. With the help of, here what happens, only vasodilation happens. With the help of vasodilation, the pain comes down. Next, water cupping. Here, water cupping, you can use either hot water. Hot means this is also plastic cup. Don't make it boiling water. Lukewarm water, the patient, how much they can balance that, or you can go with the cold water. So now, in hot and cold, everybody as a physiotherapist, you can advise patient either to go for the hot or the cold. This will be used on field more, on the sports where immediately we need a relief. So if hot or cold water is not there, we can go with the ice cubes also. Sprains, which we get immediate relief. Directly just put a ice cube into that. This can be done in the plastic. So you can just put a ice cube inside it and immediately put a cup on that and keep it for 5 to 10 minutes. So once you're using ice cubes, definitely what happens, vasoconstriction happens. So with the help of vasoconstriction, person's pain comes down, and if it is only grade 1, he will be able to get back to the ground. If it is grade 2 or grade 3, then he cannot. We need proper assessment to treat and get back to them to the clinic. And now I told you these many conditions, sorry, these many methods. So I told you like a weak, medium, strong, needle cupping, fire cupping, water cupping, ice cube cupping. So these cuppings are all the 7 methods I told you. I want to tell you what is the science behind of all the dry cupping. See, from that time I was telling on the skin it is going to happen, muscle it is going to happen. Here I am going to give you a proper method of what is happening inside. So I would read the whole slide. Oxygen and nutrients reach all the body cells with the blood flow. On the other hand, lactic acid, carbon dioxide produced by our cells, so-called cell waste, are clear also by a good and healthy blood flow. So here I told you, right, once you apply the cup on the skin, so automatically you're going to enhance the blood flow. Once your blood flow is increased, in that what happens, good cells which are there, now I am going to place this cup and do. So the area which I am placing the cup, the all the good cells will move away, and all the dead cells will come back inside the cup. Once the bad cells come here, because they don't have energy to move it out, so that time they would, the lactic acid or the CO2 or all the waste cell will be accumulated. That's where we do wet cupping. We will make a scarification, we will make a punctures on that area, and we will remove the blood out. But in dry cupping, what do we do? On that particular area, 5 to 10 minutes we are going to keep it, and we will wait that all the waste, cell waste, will be come out. But here you are not puncturing. Here without puncturing you are treating the condition. And after that what happens, you are going to create the adhesion formation in the skin. So once I'm going to create negative pressure, automatically my surrounding skin will be stretched. So once that gets stretched, so there I can say this leads to the limited motion, pain, and reduction of the blood flow. Limited blood flow causes insufficient supply of oxygen and nutrients and cell waste accumulation. In cupping, the negative vacuum causes the tissue beneath the cup to be drawn up and swell up, thereby increasing the blood flow to the affected area. Cupping stretches out the fascia, remove adhesions, and relieve motions of the tissue. This is the main thing which happens once I suck the skin. So once I'm creating the negative pressure inside the cup, so automatically the skin is being swelled up. So once that is swelled, the surrounding fascia is also getting stretched, and I am going to release the fascia. This will give you wonders of results on the back. When patients come for myofascial release, immediately only 5 to 10 minutes you do them dry cupping and just moving a drainage method you do. After that you see the patient review. So if patient is able to handle strong cupping, go with strong cupping, or else with the help of medium cupping, start from the distal area and use all the limbs which are present inside the body. You will get immediate result within 15 minutes. So here what you're going to do, you're going to stretch the fascia, remove the adhesion, and release the motion of the tissue, so which will help the cell waste to move away from the deeper layers. As I told you, if you are going to release myofascial release, if you are going to do, the deeper trigger points should be removed out, and for that if you make a medium cupping or if you use a strong cupping will give you good results. And then at that time, cupping also significantly improves blood and lymph circulation and increase fresh blood flow to the treated area, where the cell starts to get a fresh supply of oxygen and nutrients. The cell metabolism is re-established, pain is reduced, and the tissue gradually heals. In addition, bruises caused by cupping trigger certain immune response that helps to deal with flu and respiratory disease. This last point is like here bruises will be there, and that bruises will go within 6 to 10 days. And next, what is there to deal with the flu and the respiratory diseases? Sometimes what happens here, you can add dizziness also. Now if you are going to do wet cupping, once the removal of the toxin, definitely the body hormones will be moving up and down. So that time what you do, patient, if they feel dizziness, this will happen in wet cupping as also it will happen in the dry cupping. So that time you can make the patient lie down for a while, give some sugary juices or something, and check the BP level, check the heart rate, and then send the patient out of the clinic. And sometimes because of the pressure, very rarely, this is 0.1%, patient can get fever out of it, or else it may not. Like how in physiotherapy, after giving the machines, three things happen: whether it will work, it will not work, or it will aggravate. Same thing it happens here, but here there is no chances of aggravation. Here you will 90% get results, and sometimes if the patient is weak, then you will end up having flu. Very rare it is, or else nothing will happen. The bruises will be disappeared within 6 to 10 days. But if you're doing scarification, that is puncturing, if you're doing, then patient to patient it varies. But that also will come down with the help of 10 days. But proper protocol should be taught for the patient how to manage it with proper hygiene, because in the open punctures, sweat should not go, dust should not go, because they can cause infections. So those all things you can learn once you come to my workshop. I would teach you all the things practically, how to perform it and what is the protocol you need to follow. And then next, what are the things you can use? Look at it. Plastic cups. This you can use for all types of dry cupping, which I have told you now. All the 7 methods. There are different sizes you have, and this there are smallest to smallest size which you can use for the pimples on the face also, and they are the huge size we can use for the back also. There are multiple, maybe 7 to 8 size here. And this is what I was talking about, flash cupping, where only with the help of these glass cups you are going to do fire cupping. And also you can use bamboo cups, okay? With the help of the bamboos they have made the cups, that also you can use with the help of fire. And next is your silicone. This is not suitable for fire, not suitable for water. This is only suitable for myofascial release. This you have all the sizes. Even this starts from the smallest one you can use on the face, and the larger one you can use on the back. And then you have electric cupping machine, that is with the help of the current. This you can use for both dry as well as wet, but usually people use this for the head mostly, where on if the people don't want to remove the hair and they want to do cupping here wet. For dry also will use, but if they do remove the hair, it is very easy for us. But if they don't want to do it, with the help of that cup, what we do on the edges, we apply Vaseline completely. Full Vaseline we are going to apply. Then first we are going to place it directly for few seconds, 5 to 10 minutes. After that, once that area gets well, then I am going to make the puncture on that area. Then with the help of Vaseline, what I have kept, I will directly keep it with the help of that, and it will automatically suck the blood out. This we will do when patient doesn't want to remove the hair but still want to get treated for the head region. So that can be done. And next you have this rotatory vacuum suction. So that is the pro version, like I would say. Everything works same. It's just here there is no need of any pistol gun. You can just keep on rotating it, and as how much patient can think and how much you want to give the suction, that much if you rotate, it's enough. Here you don't need pistol gun. Automatically you have to release again like a screw. That's it. And the hygiene which you need to maintain is definitely your gloves, your spirit, and your mask. And also if you're following your flash cupping, you need spirit. And why do you need spirit is with the help of dip your spirit, cotton balls into the spirit, and then lighten up, so it will be easy for flash cupping. I use this method, and most of the people use this method only with the help of the spirit, but make sure the sprit particles should not fall on the skin while you're doing the flash cupping. Why? Because once the sprit particles fall on the skin, there also you can see fire evaporating. So be very pretty sure that you keep the holder away from the skin and then perform the flash cupping. And oil is used for the silicone cups where you want to do massage or where you want to do myofascial release, and cotton tissue paper, antiseptic creams if you want when you're doing wet cupping. So there is a proper protocol how to do dressing with the help of the antiseptic cream. Okay, so this is the main thing. Okay, what benefits you can get with the help of cupping? So the all those things which I have already spoken in the previous slides is this. Cupping helps to reduce pain and inflammation. Reduce pain and inflammation, immediately you will see the result in one session only. And pain, I'm not telling 100% pain will go, but some sort of, am I audible?
Yes, ma'am.
Yes.
Okay. So as I've spoken about all those things, definitely in one session only you will see 30 to 40% of the pain will come down immediately. And if it is inflammation, I would suggest go with the ice method, with the ice cube cupping, where you can put the ice cube inside the cup and place it. You will see immediately vasoconstriction there, and there is reduction of the inflammation. See, there are so many methods we as a physiotherapy we used to follow. Price method, police method, then it came peace and love. But currently, what is going on? Cascade method. So, in all this method, what you are telling, elevation, crepe bandage, everything is there. But when they are using icing also, but here icing we are going to use a pro version, that is with the help of the cups. So it is been updated. Rise police now currently which is going on is cascade method. And next we have, it improves your blood flow and promotes detoxification. See here, detoxification completely happens when you're going to do wet cupping. You are going to remove the toxins out of the body. But here when you're doing dry cupping, that time also detoxification happens. How? So on that particular area, on this particular, I have done my cupping. On this area, my blood circulation is being increased. Now after a couple of days, this will turn back again to the same color. And how does it happen? That happens because all the new cells are going to move inside, and whichever the weak cells are there, the dead cells are there, which is going to wash out and it will be removed out, but not as a wet cupping immediately. It is going to removed out after a couple of days. Then automatically this color and this color will become same. Here also detoxification happens, but with couple of days. But in wet cupping, what happens? Immediately we are going to remove the toxins from the body with the help of the scarification or with the help of the puncturing. Then use for relaxation, well-being, and myofascial release. Most of the patients who come for cupping is for myofascial release. So usually for back pain, for sciatica, mostly for trapezitis, patient comes for cupping therapy. So that time I would say go with the strong cupping, do the drainage method. That time you will get very good results for this. And next, definitely you're going to regenerate the tissue, the skin, because automatically the blood particles, the nerve endings, the which oxygen rich blood, whatever is been here will be healed automatically. And automatically the process where the tissue is going to regenerate and heal faster. Now, in the next slide, I would like to say what are the contraindications you should keep in your mind. Now, first thing, if you are planning to go for wet cupping, patient should not be anemic. If patient is anemic, then it is risky for the therapist. So, avoid for the anemic patients, and people who have vitamins or mineral deficiency, don't go for them. And next, fractured bone. Why you're not supposed to go for the fractured bone? Already bone is fractured. But do see if whether it is hairline fracture or comminuted fracture, transverse fracture, oblique fracture. In short, what I want to say, whether it is a stable fracture or unstable fracture. But if it is only hairline fracture, you can go with V cupping, where you're not going to disturb the alignment of the bone. But if it is not that, if it is unstable fracture which has moved from its anatomical position, then avoid it. Don't go, because once we are pulling it back, then automatically you're going to spoil the alignment of the bone. So instead of recovery, I'm going to aggravate the condition. And same as for that dislocation of the joint, you're not supposed to do it, because we don't want to spoil. Already there is dislocation, it is moved away from its anatomical position. We cannot help with the help of sending more fluid to that area. In that, what happens when you're sending more fluid or more blood circulation to that area, you have a chances of damaging the arteries and damaging the nerves as well. So better don't do that, because once you have dislocation already, there will be more of fluid accumulation. Have you not seen when patients have fracture cases, there will be swelling more. So in that, there is no point of giving cupping at all. Abscess will always be active. So if there is pus formation, don't do it. But here on the pimples, there are inactive pimples. That time it will give you a good results. But if you have huge papules on that, what patients will come and tell, oh ma'am, on that you put the cup and suck it out the whole thing. That is a blunder mistake. Don't do that. You are going to create condition will become more aggravated. Instead of reducing it, you're going to enhance the condition, and instead of suppressing the cell, you have aggravated the cell by sending them the nutrients. So avoiding the abscess. And definitely in the pacemakers, we don't want to do it. Patient feeling thirsty or feeling weak or dizzy, avoid doing it. Thrombosed hemophilia or infectious diseases. And also you should remember, when you're going for wet cupping, person should not be in anticoagulants medications. Like after COVID, most of the patients have started taking anticoagulants. Okay, patient is taking anticoagulants, they are supposed to avoid it for 48 hours. Why? Because this is a blood thinning medications. If it is blood thinning medication and you are doing wet cupping on that, you are going to remove more of the blood. So for that reason, ask the patient to avoid 2 days before and 2 days after. Once it started healing, after 2 days, they can start taking the medications, whatever they are taking. But make sure they are not supposed to stop their any other medications, only apart from anticoagulants. And definitely STDs or communicable diseases, because we don't want to spread nor the therapist nor the patient. So on the safer side, don't do it. During pregnancy, especially in the trunk region, avoid it. But if you can do it for the upper limb or the lower limb, if there is any requirement. And over the wounds, cut, lesions, sutures, or any implantations, avoid doing the cupping therapy. And but you can do it on the scars after the sutures which we get after the removal of that. You will do kneading, right, on that scars to enhance it. That time you can use the smaller version of the cup, and you can use V cupping, and you can mobilize the scar. That you can use. So I would say you should be very smart enough what to use and what not to use. For everything strong doesn't help, for everything medium doesn't help. Now for scar, as I told you, mobilization you want to do, you can go with the weak cupping. And next you have person in blood thinning medication, which I just told you, it is anticoagulants. Then bleeding disorders, excessive vomiting or diarrhea, you should avoid. Bleeding disorder is there. You usually patients who come for cupping therapy, sometimes when we are doing wet cupping, they would not know the bleeding clotting time will not be known. And that time what you can do, if it is continuously oozing out, I follow one method and most of the people follow the same method. You can directly compress on that area for putty a few seconds or few minutes, let the blood gets clot inside. Or else what happens, you after the first application, second application, third application, fourth application, blood will be oozing out itself. If that is happening, then you are going to remove the good blood also out. So that time avoid it, and it's better to check the patient's clotting time, how much it is. If not, if they need to do the test, then they can come to you. And excessive vomiting or diarrhea, avoid the cupping. So here you have something skin reaction after cupping. So mostly what I do with this, I use this method as for diagnosis. Okay. So these all are the places now after the first application for 5 to 10 minutes when we do, these all are the things which we will see in the patients. So now these are the three things which are very common. Rest all is not very common, but yet sometimes you can get it. But this is how you are going to diagnose. If pink is there, it is healthy blood circulation. If it's POW is there, moderate stagnation. If it is purple or black, is severe stagnation. And this type of things you can see mostly in the chain smokers or the person who is taking more alcoholic, where because of those harmful things their blood is being impaired. And these all are very rare to see, but yes, this can be seen because of the mistake of the therapist, because of keeping it for a more time, so they will get more results, so they will keep it for the more time. That doesn't work. That concept don't work. 5 to 10 minutes maximum, remove it, because automatically you are stimulating the sweat glands. So once sweat glands has been stimulated, water vapors comes out. When water vapor comes out, automatically blister comes out. And once this comes, still if you're going to keep, then this sort of black patches will see. And sometimes people confuse this white or gray to the healthy one. This can be because if the patient is anemic. So in this method only you can come to know where you will do wet cupping, where you can do dry cupping. So generally if you say here I would avoid wet cupping, here I will avoid, here I will avoid, here I will avoid, here I will avoid, in these two places I will do. And person wants to perform wet cupping in this area, I would go. But these are the two main things where I can go with the wet cupping. But rest all are good to go for the dry cupping. Now I have taken one very common incident. Okay, one condition which I have taken, which is very, very common in our physiotherapy thing, that is your myofascial trigger point. And there you can see it can be for the trapezitis muscle, majorly patient comes, the IT profession people or the where the neck is being used. So nowadays we have text neck syndrome more, ID profession more, phone usage more. The wrong posture is more in basically. So that time people come with a trigger point. But what is trigger point? So trigger point is nothing but it is a hyper irritable focal point within a taut band of skeletal muscle fibers. On compression, it can evoke typically referred pain or autonomic phenomena. Now, trigger point can be of two things. Either it can be latent one or it can be active one. So if it is latent one, so that time what happens, that you have the trigger point, but when I touch, you will feel pain, or else you will not feel pain. And this is not going to come in 1 or 2 days. When you're overusing the muscle for a very long time in a wrong posture, then you will start seeing formation of the trigger point, and which I told you, active trigger point. So this active trigger point will be in such a way, when you touch, pain is there. When you don't touch, pain is there. Throughout the time you have pain. When patient comes to you, when you're palpating and assisting them, the muscle you're assisting, that time once you're pressing them, they will tell you have pain, but when you release, they don't have pain. That is latent type of trigger point. So for both the conditions, what you can do, you can use strong cupping, and now automatically the trigger points are not going to stay in your epidermis layer. It is going to stay in your dermis layer, and if you want to bring them up, you need strong cupping. And once you do strong cupping, automatically the trigger point will come up. So in that, if you add needle cupping, what wonder you can get the result. Now I have found that one point, so I am going to suck that area in strong cupping. Now after that, after the first application, what I am doing, I am going to put a needle onto that. stimulate that area with the strokes of 15 or 10 to 15 strokes of and again apply the cup. You will see the result. So you are going to release the trigger point there. So this is a very common thing which we see here. You can use needle cupping or you can go with the drainage method. Drainage method you can use with the help of silicone cups or you can use with the help of your plastic cups. So I hope till now you guys have an idea which method should be used in which condition. Not all the methods can be used in every condition. Specific methods will be used. Yeah, this is what they are trying to say. Now once you are going to apply the cup onto that area, on the trigger point area, you have created a negative pressure inside the cup, and once that is been created, definitely the oxygen rich blood which is going to move to the other area, and the lactic acid, the CO2, all the cell waste are going to accumulate inside, all the dead cells are going to accumulate inside. And that's what I said now, if you're going to combine that with the needle cupping, you will get more of the result. Immediately you can release the trigger point, and also trigger point does not come within 1 or 2 days. It will take a couple of days or couple of months. But nowadays you go and see from age criteria of 18 years to 25 years, they all legs will be stiff because of the wrong posture using the mobile phones and because of being in the computers. For these reasons they have that from 25 to 35 or the mid 40s, because of their occupation they have taught bands. So this cupping can give you wonders of results in the myofascial trigger points. So by here I end up the session. Now I would like to listen the doubts if you have.
Now you can unmute one by one and ask your questions to our resource person.
Hi, ma'am. I'm Hari Krishna. I have a doubt.
Yes, please.
Actually, you said that we can use this coupling method for contractures.
Yes.
Will it give a good result for the contractures?
Yes, very good question. See, now I'm talking about knee, okay? So when you see CTEV cases, okay, in CTEV cases, cerebral palsy cases, what happens? There is delayed milestones. So once the milestone has not yet come for the babies who are 6 years or 7 years, but still they don't have turning also, neck movement also. They are too much delayed in the developmental milestone. So that time what happens? All of their upper limb and lower limb will go into a synergy pattern, flexion synergy pattern. So that time when this is the knee and it is already in the flex position, so what we can do is from this area, the whole limb you're supposed to put the dry cups. This cups you're going to put it on that area, and the passive exercises you will do. Passive exercises when you're doing, automatically you're breaking the adhesion in the skin. So along with the adhesion in the skin, you're going to break the adhesions which has been formed in the joint. So there you will see immediately there will be some 10 degrees of ROM will be increased. So this is not going to done with the one day. When you're doing those type of patients for couple of days or multiple days, definitely you can increase the ROM and break the synergy pattern. From flexion you can get extension, so it works on contractures as well, but dynamic cupping. I hope you understood.
Yes, ma'am. I understood. Thank you, ma'am.
Thank you.
Ma'am, actually, I have one doubt, ma'am. Just you spoke about osteoarthritis. The synovial synovial fluid will be increased. It will be increased, ma'am. Synovial fluid when while doing cupping.
Yes, see, our profession is only very good. Okay, exercise is the main thing. So along with exercise, what you're merging is cupping. When you merge both of that, now with only exercise you can increase synovial fluid. 5% you're going to increase synovial fluid. When you merge cupping with that, you
Ma'am,
can
in
increase
ma'am,
10% of synovial fluid. So
m-
definitely it is not 1 or 2 day. When patient is doing continuous all the exercises which is being helped from the isometrics to the weight bearing exercise with the help of cupping, definitely you can increase the synovial fluid and also increase the ROM of the joint and also increase the flexibility of the muscles and also increase the stability of the joint with only with the help of cupping with exercise.
Ma'am,
okay,
I
ma'am.
have a doubt.
Okay, ma'am. Thank you, ma'am.
Ma'am,
Thank
is
you, ma'am,
there
for
any
clarifying
diet
my doubt.
plan?
Yes, Shifa, go on.
Ma'am, is there any diet plan before and after doing cupping?
If there is any
Diet plan before and after doing cupping?
tight lamp,
Diet,
Diet
diet
plan, ma'am.
plan.
Diet plan.
diet plan, yes, very good question. Yes, we have a diet plan, but if it is wet cupping, we tell the patient take bath, so that in wet cupping 3 4 days we will ask the patient not to take bath, first thing. And second thing, we will ask the patient to eat light food both in dry as well as wet. They are not supposed to eat non-veg. Reason why they don't want to eat, because non-veg, if they are going to eat, their system requires more energy for digestion. So instead of going for the digestion, we want the energy for the healing of the bruises or for the cupping therapy which we have done for healing marks. And for that to happen, you will ask the patient to go with khichdi or with fibers or with the normal diet, but avoid oily foods or fried foods. These things will be avoided both in dry as well as in wet.
Thank you,
Guys, you
ma'am.
are showing good drawing skills, on board. So it's showing your name also and recording also. Hello.
Okay.
Anyone having any doubt now?
Ma'am, I have a doubt.
Yes.
Ma'am, can we use this cupping during menstruation? Because you told that during on the anticoagulant medication, we are not supposed to use it. Uh,
Yes. Yes, I got your question. See, in the
yes.
menstruation starting 3 to 4 days, girls will have massive pain, right? To
Okay.
reduce the pain, you can use cupping therapy. But you can
Okay.
use cupping therapy on the back area, that to dry cupping, or you can go with the drainage cupping. But drainage cupping will give you more results on the back region if you do, because you're giving relaxation. So that particular area, the pain will come down. But never ever go with wet cupping when the girl is on menstruation.
Okay. Okay, ma'am. Thank you.
Okay. Anybody
Excuse me,
else?
ma'am, I have a one doubt.
Yes,
I have a
ma'am.
doubt.
Yeah.
Can we use dry cupping in children with the cerebral palsy,
Yeah. Cerebral palsy, in which play part you want to give?
like knee contractures?
Yes, that's what I told you. Na, you can give. You can give. Mostly we have flexion pattern on the knees, and we have on the ankle. But ankle is very small for them, and we have the smaller size of this. If possible, you can give for dorsiflexion and plantar flexion also. By placing the cup on that area, you're going to do the exercise. But majorly, you can use for the knee, as I showed you here, no, in that way. Now, the thing is like this: you're going to place all the cups on both the sides. Here, you are going to do 4 cups, there 4 cups. Then slightly you're going to perform the dynamic exercise. You will not get full extension, but how much ever you're getting it, try to move it. Here automatically you're stretching the skin, breaking the additions, you're breaking the additions in the joints, automatically the ROM will increase. But that's what, if you keep doing it, definitely you will help the patient to get proper extension also.
This all doesn't trigger the seizures and all, right?
Sorry.
Cupping doesn't trigger the seizure if the patient has seizure problem.
Seizures problem. Yeah, in
Mm.
seizure problem, you can go with weak cupping. Okay, because it is a nerve endings. It is a neurological conditions. And here, if the episodes are on and off, if the episodes are on and off and you have multiple seizures, tremors into your hand, so this usually once the tremors continuously start happening continuously, and then the whole body becomes weak. So now you know that this particular patient is going to get seizures definitely on and off. With the help of cupping, what you can do, you can strengthen the muscle, you can strengthen the immune system, you can strengthen the lymphatic system. That time what happens, once they are going to get the episode will not be worst. Usually you see these patients who are getting seizures in the childhood, what they have, as they grow on, once they get episodes, whether they'll be out of the world and they'll be very lethargic. Why? Because the whole body goes into the tremors. So cupping can help them to strengthen the muscle, increase the blood circulation, increase the lymphatic system, and helps the body to heal. So I would say not completely cupping will support, but some sort of the thing cupping can support for the person who have the episodes.
Which is the best? I did not hear you. The cupping, which method you said, ma'am?
Weak method,
Cupping
I
method
said.
you just not.
Weak
Weak.
or
Okay, thank you
medium
so much.
method. Because
Thank you
already with
so
the
much, ma'am.
episodes they are tired and lethargic, and there if you go and do with the strong cupping, it will be very irritating.
Like you said, for osteoarthritis, knee osteoarthritis, we can give cupping as well, right? So, what will be the position of the cupping? And as in with cup, we have to do dynamic movements as well, like exercise and all. We have to do provided the cupping.
Okay, so if you're planning to do dynamic cupping, I would always say plastic cups are the much better thing. Plastic cups or the rotatory one which you saw, which I showed there. So these two are very good. So if you're going to do on the knee area, on the whole area, you can place the cups and you can make the patient to do all from the isometrics till the weight bearing exercises. One leg standing, you can make the patient just with the help of the cupping, but you should make sure if any air moves inside, the cup will come out. So make sure you are going to place in such a way the whole skin is in contact with the cup. So that time you can help the patient in the osteoarthritis cases.
But ma'am, do we give light weak cupping or like moderate
Medium
or strong
cupping would be
cupping?
okay. Medium
Oh,
cupping would be okay.
thank you, ma'am.
Okay.
Ma'am, in chronic spasm, muscle spasm, we can do wet cupping, ma'am.
Yes, you can do, but in that major thing you can go with a strong cupping myofascial release, drainage method. That will give you very good results. But yes, wet cupping also will give you, but first release the area for a while, then go with the wet cupping.
Ma'am,
Okay, ma'am. Thank you.
Yes.
one more thing. Yeah, during arthritis, we also have swelling, right? So can we use it in the initial stage or later?
See, if you're having inflammation, that means there is the what the condition is active, right?
Okay.
So once the condition is active, don't use cupping, because if it is active, you can use ice cupping. First, you reduce the swelling to that area. Either you can go with the ice cupping or you can go with the ultrasounds also sometimes, or you can go with the elevation and the compression method. So first reduce the swelling, because automatically there is fluid inside and the fluid is active, and on top of that you are increasing the blood circulation. If you increase, you are going to exaggerate the condition. So don't do on the inflammatory area. If you want to do ice cupping on that area.
Okay. And one more thing, if the person has a lumbar radiculopathy, like radiating pain, can we use the cupping?
Yes, you can use the cupping, but for that you should know the myotomes and dermatomes. And what myotomes and dermatomes will do, with the help of myotomes you will come to know which muscle it is, with the help of dermatomes you will come to know which nerve root it is. So once you come to know which nerve root it is, you apply the cups on that area. And once you come to know which myotome it is, do the exercise on that area. So this will inversely help you to reduce pain.
Okay. Thank you,
Ma'am,
ma'am.
can it be used for lymphedema patients like
So-
female patients post-operative for carcinoma of breast?
Sorry, your voice is not audible. Be a little louder, no?
Ma'am, edema
Ma'am,
conditions
can
we
it be
can do or
used
not, ma'am?
for
Edema condition, that's what I said, na? Edema is active, don't do it. If it is active, you can go with ice cube cupping. Don't go with dry cupping
lymph?
and don't start doing massage on that area. Ice cube with the help of vasoconstriction, you can reduce the elevation. Sorry, you can reduce the inflammation by making the person keeping the leg or hand in the elevated position. Crepe bandage should be done and then ice cupping can be done. So this method, if you do, edema will be reduced.
Ma'am, lymphedema patients can
Sorry,
use it for lymphedema patients.
sorry,
Lymphedema patients. The lymphedema.
lymphedema patient, you can give cupping. Huh?
Yes, ma'am.
Yes, you can give cupping for lymphedema patient.
Okay.
And one more thing I would like to add. So there are many more methods which I didn't add up into it. There are almost 16 methods are there, 16 techniques of cupping therapy which has been there, which I am going to teach you practically. You can enroll into the workshop. Then all this what I have taught here, we will be doing practically on the model, and there you will be learning how to do fire cupping, wet cupping, dry cupping, needle cupping, all sort of cuppings, weak, medium, and all you will be learning there. So if you are interested in practical knowledge, with along with the conditions, here I have only taken the one condition. There are a lot more conditions: chondromalacia, osteomyelitis, RA, and muscular dystrophy. There are many conditions where you can apply cupping and get good results. So you can enroll for that. If you have any further inquiries or further doubts, you can ask me in the message or email.
Hello, ma'am.
Thank you.
Why FTD and pregnancy is contraindicated? Hello, ma'am.
Madam, mute yourself, unmute yourself.
Yeah, tell me.
Ma'am, why pregnancy and FTD is contraindicated?
Pregnancy and
FTD.
STD. Okay. Why STD is being contraindicated? Yeah, just imagine if the blood is being oozing out and it is going to touch by mistake also the therapist, even the therapist is going to get it is an infectious disease. So it's better to avoid. But you can go with the dry cupping, but avoid wet cupping for the STDs. And pregnancy, as I told you, you can avoid trunk region, abdomen region, but you can be performing it on the upper limb and the lower limb.
Ma'am, can cupping therapy is used for improving COPD treatment?
Yes, it will work there. If you want to go for the COPD, you have to learn the how cupping works on the internal organs. And that you can come to know once you attend the workshop. Yes, COPD, asthma, diabetes, how insulin level, everything can come down with the help of cupping. For that, you should learn how cupping should be performed for the organs, which is the location. Now, as I told you, dermatomes, myotomes, because we are promoting for the physiotherapy. But these all conditions can also be treated with the help of the cupping. For that, you should know the location of which organ you're going to place cupping.
Ma'am,
Thank
is
you,
head
ma'am.
cutting is help in growth of hairs?
Cupping is helpful.
Head cupping is helps in growth of hairs.
Head cupping can be help for growth of hair, for migraine issues, for eyesight. If I'm talking about eyesight, I myself have seen in my workshop the one student I have applied on this particular area. So immediately I saw the difference in the eyesight for her. We had kept one paper and first we had asked her to read it. She was not able to read it. And after 5 minutes of head cupping, wet with it, after that she was able to see that something has been written on that. She was not able to read, because she was not able to see anything. But then she said we could see something has been written. That drastic change we got in 5 minutes. So head cupping, if it is very good if you do for migraine, if you do for hair fall, if you do for eyesight.
Ma'am, wet cupping or dry cupping?
Wet cupping, wet, wet.
Okay, thank you, ma'am.
Excuse me, ma'am. Good evening.
Yes.
Can we can we use cupping for the post-op cases like a shoulder or a knee?
Post-op cases.
Yeah.
See, if you are placing implants into it, don't do it.
Okay.
If there is no implants, if there just a repairing is been done and the melting is been done inside, that time you can use. Implants are there, it is a contraindication.
Like which cupping we can use, ma'am, for this?
For implant, if it is there.
Yeah.
See, if implants are there, better to go with weak or better to avoid.
Okay.
Because we don't want to damage the implants by sucking and creating the suction. So either go with weak cupping or it's better to avoid.
Will it reduce spasms and stiffness, ma'am?
Sorry, spasm. Yeah, you can do. In spasm and stiffness, you can go with the strong cupping.
Strong cupping.
Yes.
Yeah. Thank you, ma'am. Thanks a lot.
Okay.
Ma'am, can we use it for Parkinson's patient?
See, Parkinson's patients you can use unless the tremors are very high. And if the patient is geriatric, like 80 plus, you cannot use. If Parkinson is there in 50s or 60s, the muscle growth is very good, muscle bulk is good, muscle fiber is good. There you can use cupping. But they are already in 80, they have got seizuring gait, they have got laxity in the muscles, and tremors is too high. Just lifting hand also, if they are having tremor, in those conditions, it does not give you any result.
For what kind of things we can use this, ma'am? For correcting the posture or related to the coordination?
See, correcting the posture, it will help, strengthening the muscle, it will help, and to regaining the sensory nerves, it will help. These
Okay.
three things will help when you are going to enhance the blood flow, enhance the lymphatic system. And if you're talking about balance, yes, for balance, it will help with the help of the dynamic cupping you do on the lower limb and ask the patient to perform the exercises, all the coordination exercises. It will help in enhancing the coordination as well. But I would say age matters. If it is 80s and 90s, it doesn't matter. If it is younger age, these all can help increase the Parkinson patient.
Okay. Thank you, ma'am.
Thank you.
Is there any age limit, or can we use from pediatric to geriatric? Anyone can use it, or is there any
Yes,
age limit?
if it is peds, go with weak cupping. If it is geriatrics, go with medium cupping. If it is adults, go with strong cupping. In peds,
Extreme geriatric, like 80
up to
plus, also
7
can we use
years,
it?
you can use weak cupping.
Okay.
Peds can
Like,
handle weak and medium, and geriatrics can also handle weak and medium, but they cannot handle strong cupping. That comes with the three pull.
okay, thank you.
Okay.
Thank you, madam. We'll wind up now here only.
Okay.
Last one question. Last one question.
Okay, hurry. Carry on.
Ma'am, so far we are applying this cupping medium over the skin surface only. So
Yes.
how depth this can make an impact over the body, because our body is made up of so many layers. So capsulitis we are using and so many conditions we are using. So how depth this can make a change?
Okay, good question. After at the end, I am going to end with a very good question. Okay, as I showed you, I'll do it practical and show you. Okay, I have done strong cupping. Okay, can you see the upliftment of the skin? So when I have done, I am already feeling the stretch on the surroundings. So the skin has been totally stretched. So here what capsule you're talking about, what other things you're talking about, I would say here I am going to deal with the epidermis and the dermis layer. This two layer I'm going to deal. So the spasticity or the tightness or the spasm which is present in this two layer I'm going to deal. But when I talk about the shoulder joint, so when I'm going to do on the shoulder joint, yes, but it is not going to dislocate the area or damage the area or damage the capsule, because definitely capsules which are made, ligaments which are made, which are very strong, and it is a taut band. So when I'm creating suction also, it is not going to come, but instead when I make it like this, automatically I am going to create the adhesion in the skin. Fascia has been stretched, adhesion is been created automatically. Because of the increased blood circulation, you will feel pain relief and increase the ROM. But definitely it is not going to spoil your capsules, or it is not going to subluxate the joint, because it is not so easy to subluxate just by the help of the cupping. That is the simple answer I would say. But it is going to create an impact in the dermis layer. Beneath that it will not go, because it is not going to cause any harm to the other structures.
So even if you are having the capsulitis also, those
Yes.
conditions, it won't be helpful for that.
How it will not be helpful? See, what do we want? We want good nutrients. And how do we want good nutrients? Enhance the lymphatic system. Once the lymphatic system is enhanced, the good nutrients the blood will bring. And how it will bring? While increasing the blood circulation. See, now automatically capsulitis is there. Why it is not getting regenerated? Because the nutrients are not passing on that area. Once we are enhancing the lymphatic system, the blood circulation, the good nutrients comes to that area, and it will heal the capsule. So that's how the cupping helps.
Thank you, ma'am.
Yeah.
Mom, one last question. Will it break the synergy pattern, like in stroke patients' neurological condition?
See, flexion synergy pattern will be break once the flaccidity is been gone in the stroke patient. Have you seen stroke people have their this pattern like this flexion pattern, right? So this can be break with the help of the cupping, where automatically they will start walking in this area, in this type. So this can be break and get back the extension with the help of the cupping. This can be done in upper limb also, it can be done in the lower limb also. But this will be done if you are doing for the lower limb, you should train the patient for not using circumductory gait. And to not happen circumductory gait, you have to enhance the plantar flexors and the dorsiflexors. So once you work on that part, then work on the lower limb, you can break the synergy.
Ma'am, can we use cupping on the scar area?
Yes, you can use cupping on the scar to mobilize the scar area. Weak cupping is very good to mobilize the scar area. The scar should be healed completely, then you will get the results.
Okay, okay. Thank you.
Ma'am, can we use cupping nerve palsies?
Facial palsy on the face, you're
No,
telling?
nerve palsy, radial palsy.
Okay, radial palsy, yes, you can use it. You can use it with the exercise. Neural glides. Now, whichever nerve you're getting, that glide you will use with the help of the thing. You should know ULTTs, all the ULTTs. Along with the ULTTs, apply cupping, you will see the results.
Dear participant, don't forget to give your review on our WhatsApp group and don't forget to take your certificates. E-certificate will be sent on group on Sunday, I think Sunday or Monday. Thank you. We'll wind up here only. Thank you, madam, for
Ma'am,
your.
thank you very much, ma'am. We learned something new about cupping and lots of things we learned, ma'am. Thank
Yeah,
you very
please
much, ma'am.
give me a
It
review
should
so
be.
it will
It
be
should be.
helpful
It
for
should
me.
be on WhatsApp group. Please write on our WhatsApp group, and
Okay, ma'am.
please write your name also, which should be in certificate now only. So we have taken attendance also. It was maximum 178 participant, and we have names also. You just share your name on our WhatsApp group, and don't forget to give your valuable feedback. Thank you.
Thank you.